my nursing friends, welcome back to my channel. So today I was at school, right? I was just going to class, and then this girl walked up to me just randomly asking me like, oh my god, I'm taking fundamentals next session, do you have any tips for me? Can you tell me everything I need to learn in fundamentals? And I was like, sure, I could try. So I gave her, all the tips that I'll be doing through what we did throughout the class, all of our exams, the chapters we're covering. So I decided to do a video for you guys, everything that I went through in fundamentals, the chapters that we covered, and any possible test questions that we got, or select all that applies. I will give it to you guys. I have my notes here. I have my book. I use the 8th edition. I don't know what edition you guys have. And I do have my fundamentals ATI book that I'll kind of like go along with. And yeah, so I'm just gonna tell you guys everything that we covered in our school. Granted, every school is different, so I don't know, what type of chapters or what chapters you guys had for each exam. But I'm gonna go through mine now. So let's get started. So one of the first few chapters you're gonna cover is basically the nursing process, and that's I don't know if you learned about it in health and wellness. I had to take that class. Some people don't have to take that class, and that's when you learn about the AD-PI. So it's assessment, diagnosis, planning, implementation, intervention, and evaluation. Implementation and intervention, same thing. So you're gonna be getting questions on like a nurse is taking care of a 65-year-old female. She's having pain when urinating. She has abdominal pain. She has dribbling. That's an assessment because you're looking at what you're doing, what the patient is feeling, her pain level. All these things are assessment. But if the question is asking like, oh, the patient's at risk for falls, that's a diagnosis right there. So that's what you're going to be learning in that chapter. You're going to be learning about critical thinking. In this book, there's the ATI book. They have a great way of explaining, critical thinking, the whole priority questions, what to do first. Let's see. There's going to be a lot of patient-centered interviews. Yeah, communication is a big one in the fundamentals book for Fundies 1. You really have to know all the open-ended questions, back channeling, closed-ended questions, when to use these types of questions. Personally in our school, we had a lot of open-ended questions, so ask like 4 different options, and just make sure most of the answers were like, so tell me about your problem, or tell me how you feel about it, or how can we help you? These are all open-ended questions because you're allowing the patient to express their feelings, and when they're able to elaborate more, you could get more information out of them. Whereas like if you ask them, are you hungry? That's closed-ended. They'll just be like, yeah, and that's it. So really know the difference. It seems easy now, but when you see it in the questions, it could really trip you up. A big one is infection control, that chapter. Know everything about it, all the different types of bacterias, viruses, know the difference. Let's see. Any health acquired infection, what are risks for infections. If there's an answer choice that says wash hands, pick that one. That will always be the answer because you're eliminating any bacteria. And if it says like wash your hands before, wash your hands during, wash your hands after, it's that one too. Washing hands is always a positive thing. So don't think of it as like it's too much. Like washing hands is never too much. You're going to be learning about all these lab values, so you're going to have to know all the RBCs, white blood count, culture, neutrophils, lymphocyte, iron levels, the PPE equipment. Yeah, definitely know that. It's gonna go into the whole airborne droplet contact standard. So they're gonna be like, oh, a patient with pneumonia, what type of PPEs are you gonna wear? So if it says mask, N95, you're going to be like, maybe it's not that one because that's for airborne. So you're going to get questions like that. Let's see. Know all the infection or disease process for each category for isolation, because you're not going to, let's say a patient has chicken pox, you're not going to go in there and just be like, oh, all I need is a gown and gloves. Like, no. You need a little bit more than that. So read up on that. Know your vital signs. That chapter was a little bit easy for me. It's a whole bunch of ranges. Know the number, like a normal range for someone when you take axillary temperature, whereas if you do an oral, like what's the difference? Factors that can affect blood pressure, so know age, ethnicity, stress, pain, all these things, medication, smoking. So that was all of my exam 1. It wasn't that bad, just think communication, nursing process, infection control. That was pretty much my first exam. Okay, now let's go to exam 2. Alright, so exam 2, we started covering skin integrity. Obviously know the risk factors, impaired mobility, poor nutrition, friction, decreased level of conscious. All these things are risk factors for developing pressure ulcers. Know the stages, 1, 2, 3, 4. We kept getting questions on like tunneling. Make sure tunneling is stage 3 and full thickness exposure is stage 4. Know the complications of wound healing. Know how to manage them. Wow, my paper just flew across. Then we go into oxygenation. This was hard for everyone. You have to know the factors that can affect oxygen. Really know how the system works, like how you take in oxygen, you release carbon dioxide. And did you know that we only breathe in 21% oxygen? I didn't know that. Everything else is nitrogen, so poor nitrogen. Know about cardiac output, stroke volume times heart rate. Yeah, so know hyperventilation, hypoventilation, the difference with that. Let's see. You're gonna go into oxygen delivery, so the different types of mask, nasal cannula, Venturi mask. Know all of that. Usually nasal cannula, you'll see that with COPD patients, because you don't want to give them so much oxygen because they're already taking in, they have the whole barrel chest. Breathing exercises, know the different types, even though that sounds silly, but that is a possible test question. Alright, then we go into renal. Okay. As you can see, there's a pattern. Every system you go into, like oxygen, renal, bowel, whatever it is, you want to know the risk factors, what's causing it, what are the signs and symptoms you'll see, because these are all it's all pretty much repetitive, but yet it's different. Because see, now we're gonna go into what are normal versus abnormal urine. So you're gonna go into the color, if it's straw color, tea colored, is it clear, is it bubbly, is it cloudy, is there foul odor, is there protein, glucose, ketones, all these things. So that's for urine. Indwelling catheter. Yeah, you're gonna have to familiarize yourself with that because that took me so long to put in a Foley catheter. Okay, so that was my exam 2, I believe. I remember having something on mobility. I don't know what it is now. Why it's not in here. Maybe it's from exam 3. Yeah, so for exam 3, we went into medication administration, and as you know, there's the 6 rights. You have to know it. Your clinical instructor is going to ask you to know it. before you give any medication. So make sure you know the right med, right route, right time, right client, right dosage, right documentation, and right to refuse. That will carry, that's gonna come up many times. And as you know, like safety is a big thing. It's gonna come up on your NCLEX. I haven't taken the NCLEX yet, but they say if there's a question on safety, it's gonna overpower any assessment question. Know where you could administer medication. Could it be topical? Could it be PO? Could it be parenteral? We had to learn about mixing of insulin, but I'm not gonna lie, I did not know. I didn't really fully understand it until I got to med-surg when we were covering the whole diabetes. And someone confused me, I thought it was clear before cloudy, but it's actually cloudy before clear. So you're gonna do the NPH first and then regular then NPH. So just know that, because it took me so long to remember this. You're gonna go into nutrition, so know all these things, your protein, carbs, fats, the different types of foods, because as you know, we're gonna be educating our patients, so they're gonna be like, oh, so what type of proteins can I eat if I don't like chicken? So you have to know, you know, different types. The BMI, know all the ranges between underweight to normal, overweight, obese, anorexia, bulimia, know the difference. We were actually just talking about this in peds, about enteral tube feeding versus parenteral nutrition, know the difference. I like to think of enteral feeding as like entering, like going through the mouth, and parenteral is peripheral, like IV. You don't want to give enteral tube feeding through a parenteral, so just know that. And always remember that anything, you know, NG tube, any of that, think aspiration. Like you have to watch out for that. Make sure they know how to swallow before, you know, start putting things down their throat or making them eat. So yeah, I think that was my fundies 1. That's all I see here. And of course, like all of this is very general. This is just an overview. I'm not going into like specifics yet. Maybe another video I'll go into more specific things, but this is just a general idea for those of you that will be starting fundamentals soon. Or if you're in it right now, just make sure you are always reading. Don't ever think people don't read, because they are, okay? Like, I'm one of those that I have to like overread to really understand the information. I like to take notes. During my fundamentals class, I was doing a lot of typing. I was typing up all my notes, because then in class, like, I could just go over it and, you know, take notes from my professor. And yeah, so that's about it. Like, honestly, it's not that bad. Just make sure you read. And I'm gonna have a part 2 next on everything that I covered in Fundies 2. So make sure you guys watch it. Subscribe below. See ya.